I'm not an ENT specialist. All that I get are what you can obtain in sources on the internet and so forth. So these are not secrets. These are information that are available publicly. So I'll go forward and talk about ENT diseases. If you ask the question, what is terahertz waves? The answer is it lies between microwave and infrared on the electromagnetic spectrum. Light, visible light that you can see, that we can see one another is on the electromagnetic spectrum. And terahertz frequency is in this, in a trillion, 0.1 trillion. So what is it used for? Terahertz waves are primarily used in telecommunication where they exceed microwave. Have you got a 5G phone? If you have your 5G phone, microwave frequency. Terahertz is a frequency that is coming. If you go into 6G, that is terahertz. Okay? So the thing about terahertz wave is that it can be used for detecting substances, and our human molecule has a signature in the terahertz band. So our molecule also has a vibration in this range. That's why it's so interesting. So this tells you about the electromagnetic spectrum all the way from frequency, which is very low frequency, to microwave. Terahertz is here. Infrared, visible light. Visible light is this narrow strip on the spectrum. UV light, X-rays and all that. So rays on this side are very toxic, I would say, because they can cause mutation in your cell. So you can't go for X-rays too often. Right? So it is an electromagnetic wave band between microwave and infrared, and human cells also resonate with this. Okay, so what's so significant about terahertz? In the 1990s, new techniques were developed to generate terahertz waves, to monitor and to detect terahertz waves. Okay? Now terahertz waves can detect concealed objects, and you go to YouTube, you see videos of how other things cannot detect, X-ray scans cannot detect things, but terahertz waves can detect objects that are hidden, for example, flowing pipes. So 2011 was an interesting date because on that time they, in a very old painting, old paintings usually get painted over. They were able to discover what was underneath the surface printing. They detect a hidden painting painted in 1771, as well as the name of the artist in the old painting, which was painted over. So because it doesn't cause cells to mutate, it is non-ionizing and it doesn't disturb, they are used to study the human body. Note, it says active and passive. Our body produces terahertz wave. Any of you who practice Qigong will know. You can actually feel the energy. So, but terahertz wave was not studied for very simple. Waves to this side are used for radio, TV and all that. So they were studying under electronics. Waves on this side, including visible light, were studied using other techniques. They are called photonics, light waves. So terahertz is in the middle, and they call this a terahertz gap. Nowadays, especially in China, there's a lot of advances in photonics, and now we could study this. That's the reason why you haven't heard of terahertz waves for a very long time. We could use a microwave, you all know that, right? The frequency is such that it can agitate the molecule. So we use that for heating, right? Put in the microwave oven and it can heat it up. It's due to the energy waves. So as I said, terahertz waves can be used in telecommunication, and 6G is terahertz waves. Recently, some time back, they did a research to see whether 6G terahertz waves is dangerous to your body, and the conclusion was it's a very safe thing because it doesn't cause your molecules to ionize, and because it's see-through thing. You can shine a terahertz wave on the other side of the wall and you will see through. So it's used for security application. You can look inside plastics, textile, and you can see it sharper than current scans or techniques that we use to look at things behind the clothes that people wear and so forth, or whether they hide a gun somewhere in their body, their luggage. So in agriculture, it's also used for monitoring drought, pesticide control, and so forth. And it's very interesting. TeraHeartz is able to detect water. And how they monitor drought, they can detect the water inside the plant. And when it goes down, a drought is coming. And in China especially, the application is very fantastic. So in health or science, because it's non-ionizing, it's very safe. And it resonates at the same frequency as your cell. Because of that, TeraHeartz is called the light of life. So application in medical science. Either we use it for diagnosis, you can see. When you use terahertz wave to see inside the body, like the bone for example, you can pick up 3 layers in the bone. This is very sharp indeed. Or you can use it for therapy. Here, use it for therapy. So how does terahertz heal? It heals by 2 things. The heat can penetrate and it can do a lot of things. As far as this property is concerned, we know that infrared is very helpful, right? There's a Chinese tradition that if you, the morning sun is very healthy. Besides producing vitamin D, the heat has a healing property. We go saunas, heat make us better, make us heal. So heat has a healing. But even if you take away the heat, terahertz can also heal. So there are a lot of research done where they take away the heat element, just the frequency, it also heals. And that's because at that frequency is a frequency with which your human cell vibrates. So because of that, it's able to heal. And a lot of it is due to this. So terahertz is also known as far infrared. Infrared, there are 3 different types of infrared. Near infrared, which is the traditional infrared that you have in infrared saunas, and mid infrared, between, and far infrared, which is terahertz. So with all the infrared, they all have this ability to use heat in their energy to heal. But only far infrared, terahertz, is able to make use of the vibration of the terahertz wave heal. And that's the unique thing about terahertz. So terahertz properties, we know it's non-ionizing, we know it can penetrate through wood, paper, textiles, everything like that. It's only absorbed by polar compounds. Polar compounds are conductors of metal. We absorb by metal. Water is a conductor, so it absorbed by water. And the energy, if you study chemistry, you know what are hydrogen bonds and van der Waals forces. These are very weak force that keep water molecules together. And terahertz can change the shape of molecule. For example, protein molecule inside your body, you can change the shape, and by changing the shape, change the activity. I will comment on this later on, how to change the shape of certain human molecules. So human cells resonate at terahertz frequency. So therefore, it can activate the different molecules in the human cell. And then because of this property, it regulates biological system by changing the way it interacts neurotransmitters and receptors, the chemicals that transmit signals. Generally, the things that terahertz does to your body, among other things, is it open up blood vessels and it activates water molecules like microwave, like that. You put in a microwave oven, the molecules get activate. It increases the activity of mitochondria. Mitochondria is inside your cell. It's like the factory of the cell. Produces energy, make things for you, And if your cells are hyperactive, if it's inflamed, it tone it down, make it normal. And of course, as far as DNA is concerned, it activates the DNA. For what purpose? Number 1, for repair, create new molecules to make new molecules to repair your cell, and for duplicating your DNA. Let's go into the details. So it opens up blood vessels. Come from the heart under pressure, go into the smaller arteries. Because of the pressure, water, oxygen, nutrients, all the good stuff that you have in your body gets out into the tissue, okay? And as it go into the veins, this is a low pressure system, this is from the heart, high pressure system. The low pressure system allows the water, waste products, carbon dioxide to go back into the bloodstream. But because it's a low pressure system, not all the waste products enter the vein. So that's why we have lymph vessels. Lymph vessels are like drainage pipes. So they drain all the excess water with all the waste products and they go back to the heart. So that's how, if you can open up the blood vessels, more of this go there and then go back into the heart. You remove the waste products as well as you bring nutrients and whatever you need for your tissue to repair and to do all the necessary work to keep you alive. So it regulates inflammation. Now these are inflammatory cells in your bloodstream. That's how they look like under the microscope. It causes them to function normally. Besides functioning normally, it also has another activity. So in a cell, you have this, what we call the mitochondria. Mitochondria is a factory of the cell. It can metabolize all kinds of acid. It can transport, metabolize. It's an energy pathway. It produces ATP, which is your energy molecule, right? And when your genes are active, it gets the instruction from the genes and it produces whatever the DNA tells it to produce. So a lot of activities in the mitochondria keeps you alive, keeps you active. If you have to run, for example, your mitochondria work very hard to produce energy. So The more energy you have, the more your mitochondria. So this is very important. So we all know that your cells is alive for about 120 days. When it comes to the end of the lifespan, your normal human cell will break up. When it breaks up, it releases certain signals. Find me, eat me, and it is broken up and swallowed up by this phagosome, taken up and disposed of. See? So it's clean up, so to speak. And this is a normal process. This keeps you, your body to be healthy and alive by removing all the dead cells, removing all the things that are no longer working. And this is very important. This is part of the wastage that we have to remove. And the other thing is, TeraHeartz also activate and kill bacteria and viruses. So that's why it's very effective in infection. In fact, during the COVID, that's what's covered. Like when you have a COVID infection, you blow the lungs or the throat, it kills all the COVID viruses. Pretty potent, I would say. And in a sense, TeraHeartz can be like if you have. And so all kinds of things are fungus, bacteria, viruses, and so forth. Sterilizes them, remove them from your body. And it activates your DNA. You know that DNA is in a double helix. When you open up, then the DNA can be activated. So you can multiply the DNA by opening up and then lay another strand here and this thing. So one strand, it can become two strands. Or it can be opened up and then RNA, another molecule, will read the instructions of the DNA. And when they read it, they can print it, in essence, making that molecule that the DNA has instruction for. So it's a very unique way of encoding, isn't it? So today, we're going to talk about ENT diseases, and these are the things we're going to talk about today. As I said, I'm not an ENT specialist. All these are available publicly, so let's dive into them. Sinusitis. Has any of you got sinusitis? Never, huh? Well, it's a disease of the sinuses. Sinuses are here, inside. Usually cause common cold, and it goes away very quickly. Most of the time, the cause of the sinusitis is a virus. So when you feel your nose to be very stuffy, blocked, it could be sinusitis. The mucus cannot be drained, and if it lasts longer than 2 weeks, it probably is a sinusitis. So runny nose, post-nasal drip. Post-nasal drip is that you can feel the mucus going down the back of your throat. That kind of a feeling is a post-nasal. You get that feeling, that's what it is. Congested, feel pain, tenderness over your cheek, your forehead, as well as your nose. Usually there's some swelling on the eye, and you can't smell and taste because the receptors are there. It's affected, so that's why you can't smell and you can't taste. So these are where your sinuses are. These are the name of the sinus: maxillary sinus, ethmoid sinus, sphenoid, frontal sinuses. Okay. So when it's infected, all the mucus collect there. Yeah. That's why you have all those symptoms: pain, headaches, and all. So if it's chronic, the ENT surgeon will drain it. So they either put something in to suck it, or they can go through the mouth to drain it. So that's what happens. There's chronic infection. So you have chronic infection when you have any of this. When your nose is kind of not straight, when there are polyps, you're sensitive to aspirin, or you have asthma, some infection, you have hay fever. Hay fever, we'll talk about it later on. But that's what happens. When you have chronic sinusitis, it means there is a complication of all of this. So for most of us, we don't get sinusitis longer than 2 weeks. Okay? So how do we treat? Saline spray, any spray that you know, there are decongestants, steroids, it can be tablet form or liquid form. Anti-allergic medication can be used. Pain relievers, aspirin, Tylenol is something like Panadol like that. NSAIDs are more powerful painkillers. Now TeraHeartz has been tried. People have used TeraHeartz for sinus problems, and it improved. So the people who reported it say it's because of its anti-inflammatory effect. However, because we know that TeraHeartz can kill microorganisms, so it is the effect of this killing of the bacteria and viruses as well as the anti that cause sinus to get better. So this is a very clear cut. And why it's active is because the sinuses are just below the surface of the skin. That's why it's easily accessible. It can penetrate. Hearing loss. Any of you have hearing loss? Those who have gone to the army early on will have hearing loss because of the loud sound. Loud sound can contribute, especially in a higher frequency. So a common cause is impacted earwax. You don't clean your ears, earwax accumulate and then it becomes impacted. So you go to the doctor see all the earwax, he syringe warm water to dissolve it, and then you can hear again. Looks like a miracle. But head injury can cause. hearing loss. If you go in an accident, toxic medication, anything in your workplace, factories, viral infections, nutrition, lack of certain vitamins, you can give rise to hearing loss. If it's due to trauma to the ear, it can be transient, that means a short while only. Otherwise, if the eardrum or whatever is damaged, it can be more persistent. There is a delayed onset where in children especially you find that they suddenly become deaf gradually some years after. So this is a delayed onset. So inside the ear, this is the internal ear where your cochlea has to do with hearing, and the vestibule which you do with your position sense this is the inner ear. The middle ear is where the bones are, a set of stirrups and thing which transmit the sound from the outside into the inner ear where your nerves pick it up and go to the brain. So this is the inner ear. And outside the eardrum is the external ear. Okay, makes sense? Very simple. Anything in the inner ear has to go to the brain. It goes to the brain. The sound, whatever it is, the sensation can convert it to signals in the nerve to your brain. The inner ear is where the transmission takes place, and of course the sound is picked up by your external ear. Okay, can hearing loss be reversed? Unfortunately, no. You can't do anything about hearing loss. Except in the case of earwax, you can remove it. Infection, you can treat it, and the infection subsided, you can hear. The only way is to prevent. Avoid damage from loud. So rock concert with a loud noise can damage your hearing. Some rock musicians in the past have hearing loss because of the loud noise they have experienced at rock concert. So the important thing to remember is you must use these earplugs to block the sound from damaging sound. And when you're not in a rock concert, if you have hearing loss, to augment the hearing with a hearing aid, amplify the sound. Or cochlear implant. A cochlear implant is you need an operation to put the implant inside, and then you have a receiver outside which receive it and transmit to the inside. So right now they are exploring the use of stem cells. These stem cells will repair hair cells inside the cochlea, which is the organ to transmit sound in nervous signal. Now if this works, you can get back your hearing. We don't know whether this works. We see what people can do to discover that. But we know one thing: if we reduce the stress, reduce the anxiety and the depression, you hear better. So obviously all this interferes with hearing. And TeraHeartz can relieve this. TeraHeartz can relieve your stress, can reduce your anxiety and depression. So in a sense, while there is no cure, TeraHeartz can help by reducing it and improve your hearing, even with your hearing aid. That's what you can do. So this is a cochlear implant. The transmitter is here. Yeah. And then inside the nerve, this is the implant, the receiver, and there's an electrode that go all the way to your cochlea. So it is implanted surgically inside the ear. Of course, when you do things surgically, you open up, there's always a risk of infection. But if your hearing is so impaired, there's nothing you can do but to just take the risk so that your hearing can be improved. So the noise is transmitted here and is picked up by the hair cells inside this cochlea, and then it can go into the nerve, go into your brain, and you hear the sound. So that's why it's cochlear implant. Tinnitus. Tinnitus is a ringing sensation in your ear. You hear it all the time. Any of you have it? No, don't have it, then you're very fortunate. Tinnitus is usually induced by loud noises, and loud noises damage the hair cells, the cells inside. So tinnitus can also be caused by earwax. If you have too much earwax, you have this tinnitus or infections, and due to a condition called Meniere's disease. I will talk about that later on. Okay, a lot of substances like aspirin, antibiotics, caffeine, alcohol, and smoking can cause it. Diseases like high blood pressure, allergy, diabetes, thyroid, all that can cause it. Head injury can cause it. But if it's due to head injury, trauma, tinnitus is usually transient. That means it doesn't last. So if you are in a quiet room or you're at night and you hear a buzzing noise in your ear, that's tinnitus. It can be described by people as blowing, roaring, buzzing, hissing, humming, whistling, sizzling noise. So the cause is the hair cell in the cochlea. The sound is not heard in the ear. The sound is inside your brain. I show you. So if you have a white or pink noise, it helps. White noise is varying frequencies, pink noise system. It is aggravated by stress and anxiety also still. If after an injury you have tinnitus, it's important to have a CT scan or MRI. Why? To make sure that there are no additional damage inside the brain or inside your skull. And to demonstrate high tone hearing loss, you do an audiometry. That means you do a sound test. See what frequency you can or cannot hear. And usually the frequency that is affected are the high frequency. So when you have tinnitus, this is where you heard the noise, inside the brain. This is the auditory cortex on the side, above the ear. It is not at the ear, even though you hear it at the ear. So these are kind of cracking, roaring, buzzing, humming, ringing. These are the hair cells. Inside your cochlea, your hearing module of your inner ear, they are these hair cells. And these hair cells, when you hear a sound, it moves and it activates the nerve and you hear the sound. Very unique. This is a very unique thing. So this is your jaw, okay? And next to the jaw, this is the inner ear. The artery and the vein are here. And so that's where the cochlea is. So you realize, of course, that any trauma to the side, where your jaw is, just above it will be the cochlea. So accidents and all that can cause damage. So can we do something about tinnitus? In Brazil, a number of studies have appeared where they showed that low laser therapy effective. So they include laser acupuncture. You heard of acupuncture, but you have not heard of laser acupuncture, right? Transmetal low power laser stimulation. Okay, I'll explain why it's low metal. Low metal simply means, this is in medical language, your external ear canal is called a meatus. So transmetal simply means through the ear canal. Understand? And you know that acupuncture is traditionally done by using needles, right? You have heard of acupressure? You do acupuncture using pressure. So laser acupuncture means you activate the acupuncture point by using the laser. Understand? So this is called photobiomodulation. So we test laser acupuncture with a medication as well as ginkgo biloba. You know what's ginkgo biloba, right? Among our cultures, Chinese culture, we take a lot of ginkgo, right? It has a lot of benefits, but actually the benefit is in the bitter part of the ginkgo, which is, as you know by now, they remove the bitter part, right? That is the one that is active, surprisingly. So people eat a lot of ginkgo, no use. You got to buy the ginkgo tablets, which actually contains an active ingredient which is found in the bitter part. And they say that low laser is effective due to anti-inflammation, relaxation, irrigation. Irrigation means opening up the channels, like increased blood flow, cell proliferation, causing cells to multiply, collagen production, which is one of the effects of TeraHeartz. So this is transmetal through the ear canal. And there you are at this instrument, laser acupuncture. Do acupuncture with laser. It's another view of it. So you can use this. If you have tinnitus, put it at the ear and blow it at the ear. You can do it. Nothing to stop you. Because it is, if you look at it, it may be, the ear canal may be there, but the eardrum is actually next to air, isn't it? External air. So therefore, you can blow it through the ear canal and you can hit the eardrum. Meniere's disease. Meniere disease is an inner ear chronic disease. There's too much fluid inside your inner ear. And when that happens, what happens? There's pressure on your balance system, your vestibular. There's pressure in your hearing system. Meniere's attacks are episodic, can last about 20 minutes, a whole day. Symptoms include vertigo, nausea, vomiting, hearing loss, tinnitus, feel very full. And you can have a lot of anxiety, palpitation, cold sweats, and diarrhea. And it's triggered by a lot of things. Anxiety, stress, caffeine, alcohol, ice, sodium, pressure changes. What is the cause of Meniere's disease? We don't know. Genetic, a lot of things. Attacks can be triggered by all these things, but is it that bad? It's non-threatening. It won't kill you, but it makes your life very miserable. The diagnosis is based on audiogram test your hearing, and vestibular test your sense of balance. So if you look at this diagram and this diagram, you can see this is swollen, right? These are also so. When these are swollen, it distorts both your hearing, your muffled hearing, and then you have tinnitus and ringing in the ears, and you have dizzy spell because your vestibular is affected, right? And because these things are swollen, you feel pressure inside. So this is a very troubling disease, and this is caused by things inside here. Now inside here there are crystals. The crystals normally stay here, but if it goes into your canals of the vestibule, they give you a spinning sensation because this activates nerve and give you the spinning. So vertigo is a spinning sensation. Your head is spinning, and it's due to the canal, the circular canal. You notice that these canals are at right angle to N1. So on 3 different planes, this plane, and that plane, you feel the spinning, and it's due to the hair cell which activate the nerve. So when they spin, the nerve sensation information go to your brain and you feel it. So these particles are called autoconia. They're basically in this part. When they get into your thing, you have this spinning sensation. That's how you feel it. That's how the symptoms come about. So what do? It's no cure. Usually after 5 or 15 years, you stop. Drugs you can relieve to relieve the symptoms. Various things have been tried. Drugs to stop vomiting, antihistamines, steroids. Antidepressants have been tried. There's a new drug in the internet called SP105 appear to improve that. Something new. Let's hope they're better. Surgery has been attempted. Drain the excess fluid. Low salt diet, abstain from alcohol, caffeine. TeraHeartz seems to be able to reduce inflammation as well as the spinning sensation. So that's Meniere disease, not severe, but can cause your life to be very miserable. Rhinitis. What is rhinitis? Nose infection. Very common. You got your coughs and colds, you get a rhinitis. So allergic rhinitis, or some people call hay fever. And if you're allergic to pollen, allergic to anything, so that will be hay fever. So it's nasal congestion, running nose, sneezing, itching, difficulty breathing, usually caused by infection when you got a common cold, or by irritants. Temperature changes. As you get older, you're more sensitive to temperature changes. So you find elderly people tend to sneeze and have a nose irritation. So pollen, dust, mold, skin. People who have this rhinitis, nose irritation, very commonly, sometimes it's due to dust at home. And so one way to relieve it is to buy a vacuum cleaner that remove all the dust, right? You know of such vacuum cleaners, isn't it? So it's very common. 40% of population have it. It's 4 out of 10. The older you are, the more you're likely to get it. So if you have a family history of hay fever, asthma, and pollen, you tend to get it. So normally, if you can look inside your nose, this 5 layers. Rhinitis, you find all the mucus coming out. What's the difference between rhinitis and sinusitis? Inside the nose is okay, but in the sinus will be a lot of mucus. Rhinitis, which is the nose which is infected, or allergic reaction, you find the mucus in the nose. The sinus may be clear. So rhinitis give you this around the nose as well as forehead and eyes. Sneezing, headache, blocked nose, fatigue, congestion, itchy eye, and so forth. What do we do? What can we do about it? Antihistamine. Any of you heard of Claritin, Zyrtec? These are antihistamines that doesn't make you sleep. Normally you go to GP, they give you antihistamine, they make you feel drowsy, right? You take it, you want to go in. If you don't want to sleep, we have Loratadine, which is Claritin, or Zyrtec, which doesn't make you sleepy, and you can buy it over the counter in a pharmacy. So get that, nasal spray, steroids, and all this kind of thing. So usually after a few days, this thing goes, it's normal. And if you know certain things, certain toxins that cause you to have this, avoid them. Wash your hands, or if you are due to your pets causing you to have this rhinitis, keep pets at bay. Put filters in your air conditioner or in your vacuum. Try to avoid rubbing your nose or your eyes. It is non-life-threatening. It won't kill you. So how does TeraHeartz or far infrared help with allergic rhinitis? Number 1, itching and nose of the eye and the nose improve. Nasal stuffiness and sneezing improve. Your runny nose improve. Your mucus dripping at the back of your mouth also better. Your smell impaired stop after 1 week. No adverse effect. So TeraHeartz Wave has a very good results for rhinitis or hay fever. So how can you tell? We're here at pharyngitis, throat infection, which again is very common. So this is viral bacterial. You can see the bacterial spots. You can also see the plaques on your tongue. That's why the doctor always open your eyes, say ah. When you say ah, what happened? This thing move upwards. This thing I can see clearly. That's why the doctor say ah, that's what happened. You can see everything so clearly. Particularly blood spots of blood. Inflammation of the oral pharynx includes allergy, infection, trauma, toxins, everything, including cancer. It normally don't last more than 10 days and often not serious. We all get sore throat very often, right? With the flu, it's red, swollen, and painful. That's why we look at the back of the throat. See all this. Rest, fluids, lozenges, and nowadays we are told not to use antibiotics, right? So what do? No, gargle with salt. Very powerful to kill all the bacteria. The other thing to do is honey. So if you have to use lozenges, use honey, herbal tea, ice pop, ice cream. That's a good excuse to take ice cream. When you have throat infection, it works. Important. If you have very high fever, be careful. It may have been going to your brain. There are cases like that. Start with a throat infection, high fever, they didn't think it's serious, didn't go to see a doctor, and it end up with paralysis due to infection going to the brain. It does happen. So when there's high fever, COVID has throat infection, remember. So TeraHeartz blowing can be useful, and it's there. During COVID, people blow, open the mouth and blow directly in the back of it, just that you can blow at the ear. These are openings that allow you get at the body part. So this is what sore throat looks like. When you say this thing move up and you can see the back so clearly, all red, sometimes your spots. So this thing here that you see is a soft palate. So pharyngitis, your throat infection. We talk about cancers. There are two cancers that are important. One is throat cancer, one is nasopharyngeal cancer. Nasopharyngeal cancer is important because it is common among Chinese, southern China, especially among Cantonese. Are you any Cantonese? No. Throat cancer is a rare cancer, usually between 5 to 4, more in males, high risk in smokers and those that consume a lot of alcohol consumption is associated with human papilloma virus. There's a vaccination. Papilloma virus is spread by sexual contact, kissing or oral sex. Epstein-Barr virus is a virus that causes infectious mononucleosis as well as by sexual contact as well, poor diet and family. So in a sense, you can say throat cancer is a cancer of lifestyle since a lot of these activities are under your control. So throat cancer is here, tongue around here up to the nose. This is the oropharynx. This is where your, when you say this is where it is. The symptoms: throat pain, persistent sore throat, difficulty in breathing, coughing out blood, change of voice, difficulty swallowing. This is important. Feeling stuck, lump in the neck, and you have weight loss. All the signs of cancer. So I have in the past seen some of these throat cancers, and they have to do with alcohol, excessive, especially spirit, not beer, wine. It's very strong. Brandy, Chinese even more potent, isn't it? Mao Tai, yeah. So these are very potent, give rise. So you can't see very obvious. You can see there's a, when in doubt, you compare left side and right side. There's a difference, right? This side seems much more fuller, isn't it? Spot, swollen tonsil. This is normal tonsil. This side all red. So difficulty swallowing, sore throat, ear pain, lumps on the neck, throat, unexplained loss. Treatment: radiation treatment, chemotherapy, combination of any of the above. Immunotherapy, that means you mobilize the immune cells, activate the immune cell, target the cancer. So a lot of things have been tried. Among other things, HICU, high intensity focused ultrasound, and that appeared to work. TeraHeartz have been tried, and according to experts, TeraHeartz can break up the protein, demethylate, that means cause the cancer not to multiply. And even if it does nothing, when you're having radiotherapy or chemotherapy, TeraHeartz make you sensitive to the treatment. That's the advantage. But throat cancer has a good prognosis. After 5 years, 70% will recover. Even if it's spread, 52% is still alive after 5 years. It's very good. So that's throat cancer. It's easily available, it's around, and you use your mouth all the time to eat, so you can feel it. And as I said, it's a disease of lifestyle. It's a result of your behavior. So we talk about nasopharyngeal cancer. Your nasopharynx is here, okay, next to the brain. Your nose cavity is here, the nasopharynx, your oropharynx is here. Hearing loss, tinnitus, pain, fullness in the ear, recurrent ear infections because it's next to the ear, nosebleeds, sniffle, stuffiness. And people get nosebleeds often, they look for NPC. Headaches, facial pain, numbness, can't open your mouth, double vision, trouble breathing or talk. So sex ratio, more male than female, race, Southern Chinese, as in Southeast Asia is common, China, Hong Kong, Singapore, and so forth. Very interesting thing is, if Cantonese were to migrate to the US, the rate of NPC goes down. So it's something to do with the environment or lifestyle, right? Age of onset, 30 to 50 years. It seems to be associated with salt cure foods. So there's the Chinese New Year, Cantonese love cured foods, right? Certain meats that are cured, they're waxed. And people say it's due to that. Epstein-Barr virus seems to be implicated, and so anybody who has a family with NPC, they will take the blood, estimate virus, and if it's high, then there's a risk. Positive family history, alcohol and tobacco. Locally, we have a lot of NPC, so the local folks say that perhaps it's to do with the incense that we have among worshippers of Chinese worshippers, Chinese religion, and maybe the incense also contributes. But all this has to do with lifestyle. But of late, this NPC have been reduced, and they're saying maybe because there's a change in lifestyle, maybe we take less of the pure foods, maybe we don't use incense so much, maybe whatever we are doing that cause the cancer is better next. So NPC treatment, Early stages we use radiation. Late stages we combine radiation with chemo. And surgery we only think of it if it recurs. See? So photoimmunotherapy, this is something very interesting. So I'm going to show you a video about photoimmunotherapy. A very short video that help you to understand. Now, TeraHeartz appear to increase tumor oxygenation. What that happens is that the tumor becomes sensitive to the radiation chemo. Remember, emphasis is a deep tissue tumor at the back of your nose. You can't access it through the nose and you can't access it through the mouth. So because of that, that is some difficult. You can of course get some of it through. So how do you prevent? Lifestyle, avoid anything that is smoke, cured, or fresh food. 5 years survival, if it's at the spot where it is there's no spread, 82% survival. If it's spread to around the nose, 72%. If it's spread to distant organs, 49%. This is still considered very good. As some cancers, distant survival is below 50%, more like 20% thereabouts. So this would be, I think, quite good prognosis. Photomodulation, see what it is.
And touch screen, you can touch the screen.
No, you won't print it. Photomodulation, see how? Now, never mind if there's no sound, it's quite obvious. So this is the antibody. What they do is they attach certain chemical, photo-absorbing chemical, inject into your body, it goes into your tumor. The tumor is attached to cancer cells. Then when you near infrared light, remember this is heat energy. What happens? The cells start to expand and it breaks up. Very graphic, isn't it? So that's how it works. And of course, you require the infrared radiation, but you also require the molecule. So it cannot be done by yourself. You need a molecule with the photosensitive molecule attached, then this thing will happen. So you find that a lot of the ENT conditions are very near the skin cells, so it can be used and it's very effective. And let us remember that lasers are used a lot. We use it for a lot. This is not exactly a laser. Why I say that? Because a laser, as defined in medical practice, is a narrow beam of intense light. So it must be of high energy. Then it must be all the same wavelength. And lastly, their peaks must be in phase. You cannot be out of phase. And laser frequency ranges from ultraviolet. Ultraviolet is used for treatment of certain to visible light to infrared. So recent interest centered on the infrared laser, including far infrared, both for cancer and for all kinds. Not too difficult to find them now, of articles as well as research involving TeraHeartz far infrared. Absorption of the laser radiation leads to therapy. Now the effectiveness is due to the power output. That's why you have different power output on your iTeraCare, right? You have the lowest, which is not so high energy, low energy, then there's the middle and the one with high energy. So in some ways the effectiveness is depend on the energy. Sometimes when you do on the face, especially near the eye, you don't want it to be of too high energy, because too high energy may cause harm. So effectiveness depends on. This is important because as pointed out in the earlier slide, you can have lasers all the way from ultraviolet all the way to here. TeraHeartz is here. This device, because it's not medical grade, produce this. Medical grade lasers use this effect, much more constant. So like in the case of the cancers I talk about here, when you have infrared lasers, it makes the cancer more sensitive to radiation as well as chemotherapy. And that's what it's for, right? In short, what I'm trying to say is this: never use this as a main method for the treatment of your condition. Don't be the doctor yourself. Get a proper diagnosis, see the doctor, get the treatment the doctor recommends. You can supplement with this. It's very important to do that. Sometimes we see all the testimonials of what wonderful things it can do to people, and we think, yeah, this is a cure. Yes, it can do wonderful things, but it also cannot do some things. You must understand the effectiveness of this tool as well as the limitations of this tool. That's what I want. This is not a religion. You believe and things start to happen. No, you believe things may not happen. So we go on facts, and that's what I go on. That's why I educate people with my lectures, because I want you to know that there's more to it than what people say. Oh, just do this and you will be. It won't. I promise you. Sometimes it can even be worse for reasons that you may not understand. And you won't understand them unless you see a proper doctor, get a diagnosis, get a proper label for whatever you're suffering. When you have it properly labeled and understood, then we can work out a lot of other things, right? And that's what I do. With all this recording of my talks on YouTube, I have people writing from me from all over the world, complaining that sometimes the doctors will not the doctor may have recommended this, but doctor will not answer their questions. Because if they answer the question, anything goes wrong, they got sued. And that's what it is. So being medical, we understand the responsibility that lies behind recommending it. That's why I always say this is a home care device. And being a home care device, you don't have to see a doctor. You think it works, and most of the time it works if it's not serious. When it's serious, it may not work. You need properly understand what you're suffering from, and you know what this can do and what this will not. So when you realize this, then you know the difference between home device and medical device. Medical device requires training because it's so much focus, and a lot of these techniques using such devices, there are two grades, medical and non-medical. This is non-medical. I want to state it very okay. So at the end of the day, a lot of things and a lot of the conditions in this have to do with lifestyle choices, keeping yourself healthy and happy, maintain good health, good healthy habits such as nutrition and exercise, positive meditation, mindfulness, quiet time, whatever you call it, helps. A positive outlook help you to recover faster, help you to mobilize the energy in your body for recovery. And that I will lower your stress, spend time with loved ones, with self, and connect. The more you connect with people, the better you are. A happy life, serious, make sure you have fun and laughter in your life. So my philosophy is use of TeraHeartz to repair and regenerate, makes you look, feel young. So it is suitable for inflammation, all kinds of inflammation, all kinds of pains, all kinds of blockages. See, especially in diabetes, high blood pressure, your skin condition especially can be effective. For ladies, it helps you retain your beauty as an anti-aging effect. Not recommended for pregnancy, acute diseases, congenital implant, open wound. I've seen quite a few papers where TeraHeartz have been effective for open wounds. So I think use it with care. That's all. Thank you.